A mad dash for cash. That's how the head of the Launceston General Hospital has described the quest to save $100 million in health this financial year. For the second time, John Kirwan has fronted a Legislative Council inquiry to describe how the cuts are hurting.
From the CEO down, staff in the Northern Area Health Service are less than happy about state budget cuts.
Fairly mad dash for cash, which I'd have to say it probably is the best description of it.
After scrapping 61 fixed-term contracts, closing 51 beds and 2 theatres, the Launceston General Hospital expects to reach its $30 million savings target by July. After that, nothing is certain.
Do we think we can maintain for a third year in a row these type of saving strategies and take more out of the system? It is going to be very difficult.
John Kirwan wasn't allowed to tell his staff what was coming until October last year.
They had some inkling that things were not, shall we say, kosher, but as far as the detail were concerned, in almost every example, they were prepared in isolation from our senior staff.
To actually have to make those decisions in the absence of clinical input is astounding.
It isn't over yet. A new national funding model means the LGH can't continue subsidising district hospitals, which are over budget.
We present the options to the government of the day. That's all we can do.
The committee toured the LGH, but not before being warned about conditions in its new emergency department. John Kirwan says for the past week it's struggled to find enough beds, and in some cases patients are waiting there for surgery.
These sort of pressures are starting to be felt now. It is very concerning as to what's going to be happening further down the track in the winter time.
The committee is hoping the Health Minister will give evidence, but a spokesman for Michelle O'Byrne says she's yet to accept the invitation. Emily Bryan, ABC News, Launceston.